Welcome to R.A.T.S in Pathology, FGT and breast, racing against time for students in pathology. I am now starting a few classes on the endometrium. These are the significance of the topics to be covered. And please remember, IQ is equal to UQ. I hope you remember these abbreviations. And there are no shortcut answers. They will lead to long cut in marks. Please be explanatory in your answers. Explain, do not mention. Endometriosis. That is a question. Let us see. In this, we shall be dealing with the following subheadings. Think of the subheading. The subheading will take you to the answer. Definition. Endometriosis is defined as the implantation of the endometrial tissue in a location outside the uterus. When I say endometrial tissue, it means glands and stroma. And what are the sites of endometriosis? Generally, it is the pelvic structures, the pouch of Douglas, uterine ligaments, fallopian tubes. All these are marked in the sagittal section that is shown over here. The rectum, bladder, any caesarean scar, or the periumbilical regions are the lesser common sites. A beautiful diagram. I would like you people to kindly draw this if you are asked a question on endometriosis. There are some theories of the endometriosis. Why does it occur after all? One is the regurgitation theory. They say that the endometrial contents go elsewhere through the fallopian tubes. Benign metastasis, it is not a malignant tumor. Therefore, the spread through the lymphatics and the blood vessels has been coined as benign metastasis. Metaplastic theory, change of one epithelium into the endometrium. And the extrauterine stem cell progenitor theory. Probably some cell that has got an immense potential is getting converted into the endometrium. So these are the theories. This we shall, must, and will mention. The regurgitation theory, benign metastasis, metaplastic theory, extrauterine stem cell or the progenitor theory. Again, a fantastic line diagram. The author is here. I am not hiding anyone. The regurgitation theory. The endometrium is here, and you find that probably through the fimbrial end of the fallopian tube, the material is being sent out and it is getting implanted in the various sites. And this is a septum between the bladder and the uterus, or between the rectum and the uterus. And this is the ovary itself. Some sites are mentioned, and this is the regurgitation theory. Local spread and metaplastic. So you find that this is the peritoneal fold. The peritoneal fold is composed of the mesothelial cells. Probably there is some change in the mesothelial cell. It is getting converted into the endometrium. This is called metaplastic. Also, from the uterus through the cervix, it can spread to the vagina, it can spread to the bladder or the anorectal region. So, the local spread and the metaplastic. The metastatic theory, the benign metastatic theory, it is not malignant. Look at this one, there is profuse bleeding, etc. This is the regurgitation theory, or it can spread through the blood vessels. The green one is the lymphatic and the blue one is the vein. So it can be spreading through these, the metastatic theory. Beautiful diagrams. I would like you people to kindly draw them. And what is the morphology of an endometriosis? You find this is the ovarian tissue, and I am seeing a huge cystic lesion that is filled with blood that is not red in color but brown in color. We call it as altered blood. It is getting converted into hemoglobin. It can also be seen as small lesions on the surface, as small as 1 centimeter with hemorrhagic areas. Sometimes they can all join together to form large mass. And there can be a large cystic lesion in the ovary, which is called the chocolate cyst. This can cause fibrosis and adhesion with the surrounding tissues. So this is the gross morphological picture of endometriosis. The slide, it is not extremely important for the undergraduates, but from the exam point of view, you will have to write this. When do you diagnose a case as endometriosis? Here I am seeing the endometrial glands. The round ones are the endometrial glands, and the dark blue lymphocyte-like area is the endometrial stroma, endometrial stromal cells. So both of these should be there. Sometimes because of the bleeding, there will be hemosiderin-laden macrophages. What are the criteria for diagnosis? At least two of these should be present. The endometrial glands or the endometrial stroma and the hemosiderin-laden macrophages. Minimum two of these should be present for us to make a diagnosis of endometriosis. And you find that this is functional. Just like the uterine endometrium, there will be the projection of the hormones, there will be bleeding, there will be pain. And the inflammatory stimulus is derived from prostaglandin. This comes from the stromal cells. Aromatase is also produced by these cells, and these in turn produce estrogen. So these are there. How are they very sure of it? When they use these inhibitors, COX-2 inhibitors or the aromatase inhibitors, it is cured. They are used in the treatment. Therefore, it is said that these can be the probable cause that produces the energy for the endometriosis. This is another lesion, the uterus. This is not endometriosis but a counterpart. Just for the sake of completion, I am showing. This is the uterus which is having an asymmetric enlargement. When compared to this side is much thicker. And I am finding small cystic lesions. This is what I mentioned earlier. And these contain blood, pointed out by the black arrows. This is the uterine counterpart of endometriosis, asymmetrically enlarged, and there are small cystic areas. And microscopically, you find it will be one high power field below the endomyometrial junction. Glands, stroma, hemosiderin-laden macrophages. At least two of these must be present. What are the clinical complications of endometriosis? It is functional, and just like the uterus, it presents with bleeding during menstruation. Sometimes there can be bizarre glands. Bizarre means somewhat irregular. Pain is usual at the sites of endometriosis. A patient is having a cesarean scar. Every time during menstruation or the menstrual cycle, she will be having the pain. There is an addition to the adjoining structures producing fibrosis. For example, in the anal canal or the rectum, it can produce an obstruction. In the fallopian tube, it will be producing infertility. And there are various stages of it. Look at this one, it is causing some kind of an addition. And can you people explain what complication it can lead to? It can lead to obliteration of the fallopian tube. And this again is a intestinal tissue, and I am finding the endometrial glands and stroma in the wall of the intestine. I hope you people have understood the topic on endometriosis. Gracias.